The news day continues here on One News Now. I'm Riza Diaz. This just in, the health department reports over 19,400 fresh COVID-19 infections. That's the country's highest single-day case tally since the onset of the pandemic. That brings the country's caseload to above 1.93 million. Some 142,000 are still considered active. Now, the virus killed at least 167 more patients, while over 19,100 have gotten better from the disease. Around 27% of more than 71,000 individuals recently tested for COVID-19 yielded positive results. People infected with the Delta variant have doubled the risk of hospitalization compared with earlier mutations of the virus. This is according to a large study from the Lancet Infectious Disease in England. The study was conducted on more than 43,000 COVID-19 positive patients, which included over 8,600 individuals with the Delta variant and 34,600 with the Alpha variant. Around 1 in 50 patients were admitted to the hospital within 14 days of their first positive COVID-19 test. Researchers later found that the risk of being admitted to hospital was more than doubled with the Delta variant compared to the Alpha variant. Here are other COVID-19 stories we're keeping our eyes on. The province of Zambales has recorded its first Delta COVID-19 variant case. Governor Hermanes Ebdane Jr. said a 2-year-old child who is asymptomatic was exposed to his mother, who works as a nurse. The girl's samples were sent to the Philippine Genome Center on August 5, and results were only released on August 23. Local authorities are puzzled why the child was the only one who contracted the Delta variant from the family. A road was temporarily closed near the Bulacan Medical Center to allow the transfer of COVID-19 patients who are waiting for a bed at the Bulacan Infection Control Center. They will transfer COVID-19 patients from the triage, which is in the hospital parking lot, to the new outpatient department building. BMC Director Dr. Yordis Marushka Celis said around 305 COVID-positive individuals have been admitted to the provincial hospital. And the town of Bagao in Cagayan is calling for the deployment of medical professionals after its only doctor was removed by the Department of Health after testing positive for COVID-19. Bagao Mayor Joan Dunuan lamented that even though their doctor to the barrio was pulled out, the Department of Health never brought in a replacement for them. PNP Chief Guillermo Elizar is gearing up police commanders to properly coordinate with LGUs that will impose granular lockdowns beginning September. This is in response to the national government's initiative to enforce smaller or local lockdowns in select LGUs with uptick in COVID-19 cases. Now, under granular lockdowns, even authorized persons outside residence or appors are not allowed to leave their homes. Elizar encouraged police and barangay officials to work hand in hand to achieve effective implementation of the measure.
Ito ay isang proposal pa lamang, subalit mas maigi ng paghandaan ito ng maaga upang hindi na magdulot ng kalituhan na maaaring mauwi sa hindi pagkakaunawaan kung sakaling maaprubahan ito.
It's already been 6 months since the country started its inoculation drive, but it's only next month that vaccinated Filipinos will get to receive digital vaccine certificates. Gerald de la Peña with the details.
This is how the country's digital vaccination certificates will look like. It carries the holder's personal information, the brand and lot number of the vaccine used, and the place and date of vaccination. Everything will pop up upon scanning this QR code. Most importantly, this certificate will be recognized abroad. It will be launched in September, but initially exclusive to Metro Manila residents and overseas Filipinos. The Information and Technology Department said it would take about 2 to 3 weeks before it can be rolled out nationwide.
Ang pinaka-critical na nakikita namin yung data readiness. Allow us to have adequate preparation for the disease kasi katuwang natin sila.
One consideration are far-flung areas with poor connection. But for some lawmakers, the DICT scramble is a bit too late.
Is why are we playing catch-up? Kung umpisa pa lang, alam naman natin parating na ang mga bakuna, why did we not prepare for this as early as last year? Been calling for DICT for a vaccination certificate or vaccination card.
The DICT said it first had to wait for a sizable part of the population to be vaccinated first.
Mas kailangan niya ng datos na may first dose, second dose, anong brand, kailan tinurok. So may mga dagdag na mga variances, no?
But a lawmaker questioned as to why a certificate is needed when yellow cards are being recognized in 196 countries.
If a yellow card is already recognized internationally, then bakit meron pang Vax Cert PH? So is Vax Cert PH a support to yellow card?
Habang ipinopropagate pa lang po ang paggamit sa ibang bansa, kailangan you have to recognize both. And I think the countries also recognize. So for now, dalawa muna.
As the implementation of digital vaccine certificates is still being ironed out, the Quarantine Bureau will provide express lanes for OFWs who wish to avail of yellow cards for deployment. For News 5, Gerard de la Peña, we are One News.
The United States is set to begin offering booster shots. Are booster shots necessary, and what protection can they offer, especially against the Delta variant? More in this Bloomberg report.
It's not only boosted, meaning that your immunity in the immediate time frame is higher and stronger than it was pre-boost, but there's a lot of data that suggests that that booster shot will also improve your memory responses, meaning that your immune system will improve the number of cells that are present that will then be able to respond to a future exposure to the virus and therefore make you even better protected against infection. So booster principles there are the same way. The benefit is going to be for immediate protection, but also for longer-term protection.
Can we basically come to the conclusion that the vaccines as they are now are not sufficient to block out the Delta variant when you see a place like Vermont with such a high vaccination rate seeing cases go up at such a dramatic pace?
I think vaccines need to do two things. First and foremost, they need to protect against hospitalization, severe disease, death. And the vaccines in the U.S. are doing that even against the Delta variant. We're seeing increases in the amount of breakthrough cases that are symptomatic in vaccinated people, but we have to put that in context. The vaccine is still providing great amounts of protection against infection, and this surge in cases is really being driven by unvaccinated people here in the U.S. Now, that's not to minimize the fact that Delta is a much more aggressive variant than any previous ones, and it's challenging our vaccines in a way that we really didn't think was possible a few months ago. So Delta is stronger. It's making inroads into the vaccinated population, but the vaccines are still holding up.
And for more updates, visit News 5, The Philippine Star, and Business World Online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. I'm Riza Diaz. Mask on, wash hands, and stay safe, Philippines. We are One News.